Is my screen on,
Uh,
Akhil?
yes, ma'am, but your slides are not visible.
Okay, okay, fine. I'll just share my screen.
Yes, please, ma'am.
Yeah, is it visible?
Yes, ma'am.
Okay. But I can't see my video though.
It's fine. It is visible.
It's well still.
Yeah.
Okay, fine. Good afternoon, everybody. Okay, so at another session about nutrition and autoimmune conditions. As the topic says, managing fatigue in autoimmune disease. I think the moment you are diagnosed with an autoimmune condition, be it SLE or rheumatoid arthritis or multiple sclerosis, or you have any of these medical conditions, first thing is you have a mental fatigue. Okay, the moment they say that you are having this condition, so the mental fatigue has set in, and because of which everything becomes compromised. So any conditions, what very important is accepting the situation and accepting the concern makes you very lighter and keeps you better also. And once you develop these kind of conditions, okay, you will start thinking too much, which adds on a lot of stress, and imbalancing your nutritional status, okay, creates more fatigue in you. So let us understand more in detail today, okay, how to tackle this situation. So as the title says, it's managing fatigue in autoimmune diseases, nutrition's critical role in energy restoration, and here we'll particularly understand on iron, B12, protein, and diet, how it's going to impact. Okay. So the topic of discussion will be, first I would discuss on why fatigue occurs in autoimmune conditions, the role of chronic inflammation and immune dysregulation, and deep dive into iron, B12, and protein deficiencies, and drug nutrient interactions, and diagnostic evaluations, and practical nutrition strategies, and balanced meal planning. Okay. So first, I would like to define what is an autoimmune fatigue. Okay, so it is like a battery alert. Persistent tiredness would be there. Okay, so probably if you have not charged the battery completely, okay, the duration of the battery being available, okay, or like for example, these days we have this torches and all those things where if your battery is on the lower side, okay, the brightness of the torch will be much lesser. This, why does that happen? Because of the battery storage being on the lower side. So compare the same way. Okay, so you are already diagnosed with an autoimmune condition, and what happens, you are going to be compromised, okay, on food. Okay, because these days most of us follow the social media, or we kind of log into Google and do so much of search ourselves. We don't kind of specifically go and approach a person, okay, getting to know from them what is right for me for this medical condition, what food can be taken, what food should not be taken. We would not kind of consider to ask a person who is, I mean to say, educated, qualified on that subject. But what we would do is like we randomly refer the articles which is more generic. Okay, the conditions given there may not be applicable to you. But what happens, your mind will start playing, okay, there by looking at those things, what is given there, and you will start kind of depriving yourself from many, many options. That will kind of cause into many deficiencies. That's the reason it is not because of the autoimmune condition that you're going to kind of develop all kind of deficiencies. It is the lack of deficiencies that you're going to create yourself by minusing many, many foods. So that's the reason, very important, you should balance your nutrition in the right way. And once your nutrition deficiency settles, obviously there will be a brain fog because your oxygen availability will keep going low because your iron levels are on the lesser side. And the next thing is you are having a less tolerance to carry on your daily activities also. You will stop exercising. So where do you think you will have the proper muscle strength? Even that is getting compromised. So the key concept here I would want to add is fatigue is multifactorial. It is a combination. First thing is you have an inflammation and you're going compromised on nutrition, and drug is essential. Okay, with the compromised nutrition, what has happened? There will be a lot of hormonal variation, and this is going to become a vicious cycle now. Okay, so you're taking a lot of drugs, there is a lot of hormonal variations, you're deficient in yourself with the nutritional availability, where you're not kind of giving the recovery status to get better. Now, why patients feel fatigued? As you know, chronic inflammation generally happens when cytokine levels, that is your IL-6 and TNF alpha, is on the higher side. And there is a mitochondrial dysfunction, which means that reduced energy levels at the cellular level. And anemia is a preset factor, okay, because it could be a combination of medicine, a reaction also, and deficiency in the nutrition intake. Both of them they adding together will lead into iron deficiency. And then lifestyle factors, so you're always kind of, because of the pain, inflammations, your sleep quality also goes low. You're restricting yourself from physical movement, always lying down. Okay, more amount of stiffness, because of which again inflammation is going high. You just see the research insight that has been added here. Micronutrient deficiency do not just cause fatigue, they actively worsen the inflammation and overall disease severity. So it is just a small inflammation that kind of leads to many other complications depending on how you handle the situation when you are diagnosed with an autoimmune condition. And in inflammation and energy drain, okay, what happens? The immune system is in autoimmune patient is constantly on, leading to increased metabolic demand and cytokines crossing the blood-brain barrier and reduced cellular ATP. And inflammation induced fatigue syndrome. Okay, so how to put this way, this one in simple ways. Okay, so your body is in a compromised state. Okay, so there will, even if the cells are good, the continuous attack will keep happening in an autoimmune conditions. So that's the reason you have the word saying that the immune system in autoimmune patient is constantly on. Okay, so it will keep destructing the cells. So if the destruction of the cells keeps happening and you don't give a food that is well balanced or healthier, okay, the destructions is much more, and your body is in a catabolic state. Okay, lack of energy, lack of oxygen state. So because of which you will be having all the other simple conditions, like for example, you will have nausea, simple symptoms like decreased appetite, nausea, always feeling tired, okay, wanting to sleep, oh, low on energy level, low on moods, not interested in doing anything. Okay, so who is creating all this? Because you have not kind of taken the step to handle your medical condition in the right way. Okay, these days, if we see, I think everybody has some medical condition or the other in today's world. Okay, but only thing is how we handle the situation that keeps you always better. The critical role of iron in autoimmunity. Iron is the cornerstone of oxygen. Okay, so if you want to have the oxygen circulating in your blood, okay, the iron is the important factor there. So if this has to be retained, okay, having the this has been blocked. Why? Because of the epicodin elevation. So I just want to read the lines here. Okay, so hepcidin elevation basically is seen in conditions like chronic inflammations where high cytokine levels are constantly present. This hormone blocks iron absorptions from the gut and stored iron. This results in a functional deficiency where iron is present but locked away and inaccessible for vital functions like oxygen transport and mitochondrial energy. So because of the autoimmune cytokines being getting blocked here, it is happening. So very important is you kind of have a balanced nutrition. You will be able to keep the inflammations at the lower levels, and which gives you a better energy level. And as you see here, reduced immunity and profound fatigue, because of which that is the result that you would be expecting when your role of iron, if the iron levels are on the lower side. Next, talking about B12, which is the next important nutrient. Nerve and blood health is very important. The primary functions of vitamin B12 is red blood cell production and then optimal nerve function and DNA synthesis and repair. In a normal person, this is the way the vitamin B12, if you're adequate on your food, okay, this function happens in a normal way. In autoimmune diseases, what happens is generally you're diagnosed with pernicious anemia, then malabsorption syndrome, and medication-induced depletion is also seen. So very important is to balance the food here. Okay, in the further slides, I will be taking into like what are the richest sources of B12 and all those things. And low B12 levels directly correlate with reduced oxygen delivery to tissues, resulting in chronic fatigue states. Okay, see, you have a condition called as autoimmune. It does not mean that, okay, because of this autoimmune conditions, I'm landing up with all this concern. Oh, whatever I eat, I would not be better. This condition is going to harming me this way. No, that is not at all right. If you balance your lifestyle in a better way, you will be able to delay the prognosis of the condition. Okay. And I think we can talk about if the diagnosis is done at the initial stages, you're balancing all your four pillars of life. Okay. I generally call this as four pillars for the human life. That is one is first is diet, second is your sleep, third is the stress management, and fourth is the exercise. If you manage all these four pillars, okay, you will be able to lead a healthier life. It is not only with people with autoimmune conditions. For all of us, these are the four pillars in life. We have to keep it going irrespective of age. Okay, be it a kid or an elderly or an adult or a school going, all of us should balance all these four pillars, and it is the essential thing of our life, I would say. Now, protein, okay, the general recommendation once you are diagnosed with an autoimmune flare, okay, is up to 1.2 grams. Okay, so this is not like a recommendation I have been giving you. This is up to 1.2 grams of protein can be given because you will have an increased protein breakdown and there will be steroids also in certain conditions. Steroids will be recommended and during steroid and there will be a muscle loss also. So to maintain all these three conditions, it is important that you step up on your protein intake. But again, getting a customized and personalized advice is very essential. And what of type of protein is to be included is also very important. And then benefits of stepping up protein, you will have a supporting the metabolic rate and your energy levels, and you will prevent muscle wasting during active flares, and it also kind of helps you to keep your immunity levels better, so your body will be able to fight the infection in a better way. That's the reason protein balance is always important. Plant protein is generally preferred over animal protein in autoimmune conditions as it is less inflammatory. Okay, for example, I just want to add one line here, like for example, rheumatoid arthritis, I have heard from people, I've stopped having milk and milk products because I think arthritis, you should not be having milk and milk products. It is not that. Okay, with arthritis, it is not that you're not supposed to have milk and milk products. The quantity and the frequency and the timings makes a lot of difference. Okay, like for example, curd, you should be having okay during the day, but not after sunset because it is heavy on the gut. And milk not as a plain source, okay, probably as a flavored milk, maybe like a turmeric milk or a pepper milk, those kind of flavors, okay, which will kind of help you. Okay, it will become like an antiseptic by itself, and it will kind of keeps your okay inflammation levels at lesser thing. And then very important, high protein intake should be monitored by a professional, and a customized meal plan should be advised, especially in individuals with underlying kidney concerns. So don't take this 1.2 gram as a general recommendation. Here it has to be customized based on your other comorbid conditions. And yeah, see, this is just an information slide. Okay, so it is not only with the I mean, the autoimmune condition medications that you're going to have a drug and nutrient interaction. Probably with an antacid also you can have a drug and nutrient interaction, or with a normal painkiller also you can have a drug and nutrient interaction. So, but here talking about like the medication when you're on steroids. Okay, so general depletions that we see is calcium and protein. It does not mean that, okay, even if you're taking steroids, your calcium and protein are depleted. But if you're balancing your food with the proper servings of calcium and protein in your daily diet, okay, you will avoid the impact that it's going to have on the muscle loss, or you will not have that sleep disturbance also. So what am I trying to tell here is, with drug you will have a nutrient interaction, but what is important is how you're going to balance that with the calcium adequacy in your diet in a daily requirement and protein adequacy in your daily requirement. You will be able to kind of stop or restrict the muscle loss, and you will have a better sleep pattern. And same way with methotrexate, you can have folic acid depletion, but which repairs, so where there is a cell repair inhibition. So it is not that it is a must to happen, but I think ensuring that your food is rich with folic acid, you can avoid this concern. That is what you have to try to understand in this slide. Then hydrochloroquine, various GI impacts you can have, but how do you kind of modulate on your what is that, prebiotic foods, probiotic foods is what is important, so that if your gut strength is good, okay, your nutrient absorption will be always good. And metformin, as you all know, B12 deficiency is very common, but I think very important is how do you balance your B12 levels at the same time, so that your nerve fatigue and anemia is not much. Now, talking about nutritional interventions for vitality. Okay, so anti-inflammatory focus is, like, I think, proven with anti-inflammatory, I'm going to say, with autoimmune conditions. Omega-3 fatty acids for joint health is very going to help you in a right way, and polyphenol rich colorful produce. Here, how I would add in a simple way is, like, for example, you want to choose your fruits and vegetables, go by the rainbow colors. Okay, in a week, you should be finishing all the seven colored vegetables. In a day, at least pick two colored vegetable and one colored fruit. So by the end of day 1 to day 7, you have met with the requirement of all your micronutrients, where your polyphenol rich colorful produce is also met. And whole grains always better than the simple grains, that is your simple starches like the maida, corn flour, never ever include them. And then coenzyme mitro helps in the mitochondrial efficiency for the metabolic health, so balancing that is also essential. And I think with autoimmune conditions, usually would be advised to take those medicines, okay, additional from your food. So it's not a wrong idea to kind of stay away from medications with this condition. I think when doctors suggest or prescribes, please do take them. And magnesium for muscular relaxation is very important, and hydration is very important, and the key goal to keep your cognitive clarity. And consistent dietary modifications reduces systemic inflammation markers by up to 30% in autoimmune cohorts. These were some of the studies which were done, and I think there was a 30% reduction in the autoimmune, the inflammation levels. So it is not that one thing supports everything. It is like a combination of everything, okay, makes you feel better. And diagnostic markers are very important. Like, if at all you're diagnosed with any autoimmune condition, given a medication, it is not that you're going to randomly follow, okay, all through your life that medications, but do follow with your doctor at the regular intervals as suggested, and do your diagnostics. Particularly preferred is the hemoglobin levels, ferritin, transferrin saturation, B12 and D3 levels. Periodically, if you do these levels, you will understand what are the corrections required, and you will be able to correct them immediately. Okay, then, like emergency hospitalization, severe anemia, okay, blood transfusion, you will not get into that status. That's the reason whenever doctor has suggested you for a review and a consultation, please do follow up and get the diagnostics very frequently. And inflammatory markers, CRP and ESR levels at periodic intervals, and metabolic markers like albumin and thyroid profile are very important. Okay, fatigue is not just the disease, it is often the nutrition. So don't consider, like, once it is diagnosed with autoimmune condition, okay, it is a part of autoimmune condition. No, if you're balancing your nutrition well, okay, fatigue can be at bay. Then the nutrition correction strategies, restoring vitality through targeted intake. So, before I go on to the details of it, I would like to say that, okay, even if your food is balanced well, for the autoimmune conditions, the medication suggested by the doctor is very, very important. Do not modulate on your dosage by yourself. Do not stop the medications by yourself, but be consistent and I think follow up with your treating doctor regularly along with the medications, the nutrition strategies can help you, okay, to be at bay on your fatigue condition. Dietary sources of iron. So today, as I told you, we'll discuss about B12, iron levels, and protein balance. So iron-rich sources in vegetables you can predominantly find in spinach, beetroot, and garden cress. Here I want to add a hint. Garden cress are called as alvi bija in Kannada. Garden cress seeds are not supposed to be taken by people who have thyroid condition. Okay, so please get your customized plan. Okay, whenever you have kind of taking any food, don't generically follow as it's been suggested here. It's a generic suggestion which is being given here. Then talking about sweets, okay, jaggery, okay, organic jaggery. Again, it doesn't mean that you will be having like 1 tablespoon or one, okay, up to like 15, 20 grams. The quantity and a replacement for your simple sugar is required here, but not more than 5 grams of jaggery, but preferably organic jaggery. Okay, again, in a non-diabetic conditions, but not in people with diabetic. Again, dates is a very glycemic index high fruit. Okay, so please do not consider to take that if you have a diabetic. So the better choice of fruits will be given in your cases. But this is a generic iron-rich food which is mentioned here. Then talking about grains, okay, lentils, beans, and pulses are good sources of iron too. So considering to include your protein at every meal is very essential. How do you kind of make your iron absorb better? By enhancing vitamin C availability like an lemon or an orange or amla for better absorption, and generally avoid coffee or tea near the meals as they inhibit the uptake of iron. And talking about B12 sources, the bioavailable sources are whole eggs and dairy if you tolerate it, and then fatty fishes, particularly the salmon and sardines, and fortified cereals and milks. Due to malabsorption issues, autoimmune patients often require therapeutic supplementation beyond diet. So, okay, along with the food intake, okay, if doctor has suggested you a B12 medication, do take it, but not as a over-the-counter drug. Then talking about protein optimization tactics. For example, it's very important whenever you take protein, it doesn't mean that it is absorbed fine. The combination is very essential. Okay, so dal with rice is a complete nutrition, and then your protein is also absorbed well. The other vegetarian sources of protein are like your paneer, tofu, pulses, and sattu, and of course the nuts and seeds also, which have a good fat. And the non-vegetarian sources, lean proteins are good in autoimmune conditions. Okay, the egg and fatty fishes, which are good sources of omega-3. But again, the frequency, portion size, and the quantity. This has to be customized. Strategy, spread protein across 4 to 5 meals rather than one large intake for better muscle synthesis. This I see commonly in people. I have to take a lot of protein. They would be lacking completely their carbohydrate, that is the rice or the grain source intake. They would just take protein. Do you think your protein will get absorbed? No. It does not. Second, okay, if at all your requirement for a protein for a day is around 50 grams, you're just having around 30 grams of protein in breakfast. Do you think that protein is absorbed? No, it is converted into fat and stored because it depends on the activity that you have had. Then only you will have the absorption. So again, the protein distribution at every meal is very essential and not at one meal if you want your muscle synthesis to be better. If you want to gain weight and you want to kind of add on to your saturated fat, your visceral fat, your abdomen fat, then I think you can randomly intake protein. But there, what will be the, I mean to say, concern after that is you can have high cholesterol levels. Okay, it can be a burden on your kidney. Okay, so that's the reason distributing your protein and taking the right kind of protein is very essential. 1 to 1.2 gram per kg body weight has to be from a customized plan. Don't follow in as a generic way. And I would just call this as an anti-fatigue plate model. The reason here is, okay, 25% of high quality protein, which I showed on a previous slide, and then 25% of your plate should be filled with the whole grains, that is the complex grains. For example, it can be ragi, varieties of millets if you are habitual to, okay, wheat, better quality of wheats, then rice like brown rice, boiled rice, those kind of things instead of the raw rice. Okay, then you met your whole grain requirement where your complex grains, okay, absorbs better also and gives you a better satiety level and keeps you on the energy levels also in a better way. And 50% of diverse vegetables and fiber. Okay, do not eat just one kind of vegetable or the same colored vegetable every day. Keep choosing all colored vegetables. Added essentials will be your omega-3 fats, that is the flax seeds, fish, if you're non-vegetarian, can be included. Apart from flax seeds, you have many other nuts and seeds. Okay, but personalization is required about the combination and the quantity that could be included. Probiotics, please do not forget, this is very, very essential. At least one serving of curd every day. And how do I keep my gut fatigue connection better? Okay, so even if you eat well, if your gut is not good, okay, the absorption factor is going to be poor. Okay, only if your gut is going to be good, okay, your overall health will be good. So to keep your gut good, two things are very essential: prebiotics and probiotics. Prebiotics are going to be from your fiber. Okay, it can be salad every day, one serving, or infused waters. And probiotics you usually get from your fermented foods. But again, here a simple example. Like, for example, you made a dosa batter, okay, grind it on Monday, okay, you're using it on Friday. No, the sourness of the batter is so much, okay, it can cause you inflammation rather than acting as a probiotic. So it has to be a fresh batter just within a day or two. It has to be used, not for a longer time. Then you get the good bacteria. And proper hydration. Whenever you want a gut strength to be good, hydration is important. Again, here, drink a lot of water doesn't mean that you drink 5 to 6 liters of water. It is important that you take what is required by you. The simple way how you will, I mean to say, diagnose or identify yourself as hydration, your urine color will be the simple identification for your hydration. Your urine color has to be pale yellow. If it is dark yellow, you are dehydrated. If it is white, you are overhydrated. So this is a simple way to kind of know your hydration level. If any comorbid condition, if the doctor has suggested you to, so with gut microbiota being good, you will have a good immune system, your digestive health will be good, your skeletal and muscular health will be good, metabolic health will be good, cardiovascular and the mental health will be good. So gut plays a very important role, so respect your gut. So this is just simple, practical daily nutrition plan. Okay, so for example, morning breakfast, you can have a protein-rich breakfast along with a grain source, whatever you are habitual to be, depending on whether in the north, south, east, west of India. Okay, whatever your habitual grains, do include that in your breakfast. And lunch, let it be a balanced plate method. Okay, and of which 50% should be vegetables and at least one serving of curd for your gut health. And evening, best choice of snack, handful of nuts and a serving of fruit. Good antioxidant, rather than picking on any oily snacks, fried snacks, biscuits, those kind of things. And dinner, light protein and easy to digest fiber. Generally, when I say easy to digest fiber, take a cooked vegetable rather than raw vegetables at dinner. And maintain in general 2 to 2.5 liter water daily. And key takeaways from this discussion today is fatigue is multifactorial and requires a holistic view. Always screen for iron, B12, and protein status. Personalized nutrition is a vital adjunct therapy. And this is from my side today. Okay, any questions, please, I'm going to say share in the comments also, or we can take the questions now as well. And but before ending the session, I would just like to add on at Chanry, we have started the Chanry Care Center where we are having a holistic approach, okay, from the diet from the exercise and the yoga expert and from the psychology expert. Okay, see, as I started this discussion, I told mental well-being is the first thing which is being affected whenever you're diagnosed with any medical condition. So I think psychologist counseling can help you how to handle this situation. And then the yoga therapist can kind of let you know, okay, how to keep yourself, okay, calm. What are the meditation exercises you need to be following based on your medical conditions. And yoga, apart from just, I think, yoga and meditations, you have many more therapies where the yoga expert will be able to guide you. And talking about physiotherapy and strengthening or stretching workouts, my our physio team will be able to guide you. And at Chandray, as a dietitian, I will be able to guide you on what suits you best on the diet part. So if you're interested in getting into the program, just scan on the scanner and you will be able to kind of log in and know all the details, and we shall be getting in touch with you for the same. And in case you want to kind of personally contact us and ask us any queries, you can contact on these numbers and check on us. Okay, we'll be able to guide you on how this program would go on. And any other queries related to the topic that we discussed now, you can also share it on the comment or and you can let us know. Thank you.